Starting Monday, community physicians, nurses, pharmacists, dentists, and other healthcare professionals like chiropractors, massage therapists, physiotherapists, and optometrists will be able to book their vaccination. To support and associated staff of the healthcare professionals that I just mentioned are also now eligible, and this includes reception, cleaning, and security staff, so that we can make sure that these healthcare workplaces are protected in their entirety. Other parts of the healthcare system not yet covered in our phased vaccination plan are also now eligible. This includes anyone working in patient care facilities or providing services directly to clients in the community for Alberta Health Services, for Covenant Health, Alberta Precision Labs, Dynalife, and students doing practicum in clinical areas. Healthcare workers on First Nations reserves will also be able to book. The full list of healthcare workers that are now eligible in the first rollout of Phase 2C can be seen at the alberta.ca website. As always, our focus is on protecting those most at risk of severe outcomes and of stopping the spread. These healthcare workers care for Albertans when they are most vulnerable. By vaccinating them now, we'll help to prevent COVID-19 from spreading to those at highest risk of severe outcomes. This is another important step forward, but it's just the start. Due to limited supply of vaccines, all other groups in Phase 2C will become eligible as Albertans receive more supply. So as of Monday, more than 1.7 million Albertans will now be eligible to get the vaccine. To all of them, I say, if you haven't done so yet, please go out and make your appointments and book as quick as you can. Pharmacies and AHS staff are ready and waiting to help you out. To everyone else who is still waiting, I say that your time is coming soon. We're going to keep expanding and get you your dose as quickly as possible. Throughout this spring, we're expecting well over 100,000 doses of vaccines to be shipped to Alberta every week on average. If those shipments show up like they're supposed to, we'll be offering every adult a first dose by the end of June, if not sooner. That's less than 3 months away. So the end is near, and every dose we deliver gets us closer to getting back to normal. But until then, we need to protect lives and livelihoods as we continue to face the challenge of this pandemic. Having said all of that, I did lay out on Tuesday the kind of what the next 3 months could and should look like as we build up population immunity through the vaccine program. Once the vaccines catch up to the variants, we absolutely can get back to normal this summer. We anticipate that we can get to something like 70% protection of the population, either through first and second doses and or immunity acquired through natural infection by the end of June. And I laid out some pointers about what that means. In other words, I believe we're going to have a Calgary Stampede. We're going to have outdoor events. We're going to have most of these restrictions lifted gradually through May and June. But we've got to get through the next few weeks and beat the spike.